We are here to talk about what truly is a community-wide problem. When you have a community-wide problem, you need to have community-wide solutions. One entity cannot do it on its own. Opiate addiction is, as I've talked about and referenced many times over, is a scourge locally. It's an issue that, as I said, is not something that's just a Erie County, Western New York issue, but is being dealt with all across our country. And one of the things that we need to do is try to have local level solutions to address these issues in our community. There's no one answer to it. There's no one nationwide answer, and there truly is no one local answer, but every little bit of effort can make a difference. We are working together in Erie County to fight the pervasive and unfortunately nasty effects of opiate addiction, an addiction that often will last a lifetime, regardless of what type of treatment you may have. As we're seeing all across this community, this is not an urban problem. Too many people think that this is an issue solely with individuals who live and reside in the city of Buffalo. That is not the case. Opiate addiction is all over our community, whether it be the urban, suburban, or rural areas. And truthfully, it's had a very, very nasty impact on our rural areas. It's something that we know touches people's lives all across this community. Many people in our community who never thought that they'd come in contact with an individual who suffers from addiction now find out that a family member or a coworker, someone that they know very well, suffers from these addictions. The idea of what a drug addict is has changed over the years, and this scourge of what can happen when somebody becomes addicted to opiates is the kind of thing that people wouldn't have thought of for family members or coworkers even up to 10 years ago. But now we realize that the face of drug addiction is changing all across our community. Today we're taking another step forward in Erie County to address that, to try to help those who need help get off their addictions. The Tower Foundation is providing critical support through the provision of a $64,000 grant to boost our response and better protect the community in general. These are the types of partnerships that we have to have in place if we are to address these issues.
So I'd first like to offer my personal thanks to Donald and the rest of the Tower Foundation team for your support and leadership on this issue, so thank you. And this grant represents another piece of the puzzle in our community's efforts to combat opioid addiction. In conjunction with ongoing efforts like the distribution of naloxone to first responders, this grant will bring Erie County a little bit closer to getting our collective hands around this public health crisis, which has already claimed 147 lives this year. We're aiming to confront two specific challenges with these funding. First, we want to block one of the most common and heartbreaking paths to addiction, legal painkiller prescriptions given to patients by well-meaning physicians. So often we hear from opioid-addicted persons that their addiction originated at the doctor's office. Legitimate concerns about pain management had led to an overprescription of powerful opioids over the past several years. So this project will develop and disseminate a rigorous set of pain management and opioid prescribing guidelines for our area healthcare providers. Working hand in hand with area health systems and health insurers, our goal is to arm all healthcare providers, including doctors, dentists, nurse practitioners, and physician's assistants, with the best possible training and information for responsible pain management. We need to make sure that today's patients do not become tomorrow's addicts. The second goal of this grant is to address the shortage of doctors in our community providing treatment for those who are already addicted. We know that the best tools to treat opioid addiction long-term is combination drug of buprenorphine with naloxone, commonly known by the brand name as Suboxone. As an alternative to traditional opioid therapy like methadone, Suboxone allowed patients an in-home option to manage their addiction and run their lives as usual. Unfortunately, there is a shortage of physicians in our area and across the United States who are certified to prescribe buprenorphine with naloxone to their patients. So to reduce that shortage, we will be launching a program providing free training for area physicians, enabling them to offer this potentially life-saving medicine to their patients. In addition, this grant will promote a telemedicine initiative to increase the availability of addictions treatment as standard primary office care. These efforts represent two important new fronts on the board of opioid addiction, and I believe that they can save lives.